Well, first and foremost, we knew that infant mortality is actually an indicator for overall child well-being and health. So when those infant mortality rates are high, we need to pay attention because it's really one of those early warning signs that there could be bigger issues here. The causes of it are really being born too soon, being born too small, birth defects, unintentional injuries, those kinds of things. What leads to those outcomes, the contributing factors, are really the maternal health. Some of those big ones are obesity, gestational diabetes, smoking while pregnant, and maternal drug or alcohol use. Again, we want to make sure that expectant moms have all the care and access to professional care that they need to make good choices so that we have healthy kids both from birth and throughout their childhood. You know, it's a big concern. Pregnant mother smoking is a particular concern in Indiana because we know that more than 1 in 7 expectant Hoosier mothers smoke while pregnant. So again, we have more than 1 in 7 of our pregnant moms are smoking, and that's nearly twice the national rate. Smoking is more likely, if you smoke, you're 27% more likely to miscarry. You have an increased risk of a lower birth weight baby and an increased risk of SIDS. So again, we know all the rates. Many of us know that smoking while pregnant is harmful. What I think we need to pay attention to and ask the question of why so many Hoosier expectant moms continue to smoke, and what can we do about that? Well, the good news is Indiana is making progress. More than a decade ago, we were at approximately 8 deaths per 1,000. In 2015, that dropped to 7.3 per 1,000. If you ask why that is, in 2013, our Department of Health actually made it a top priority. They started to take a really hard look at and really do some training and outreach around maternal smoking, SIDS, mom's health, infant nutrition, all of those components. At the same time, the bad news is Indiana is still higher than the national rate. For the United States, it's 5.9 deaths per 1,000. So again, that 5.9 nationally compares to 7.3 in Indiana. So some deaths aren't preventable, but we know that many are, and we need to keep working with that outreach and education for our expectant moms. The single most important thing we can do related to infant mortality is to support those expectant mothers. We need to make sure that they know about prenatal visits and the importance of prenatal care. We can work with them to make sure that it's accessible and affordable. We need to make sure that they have transportation and to help them get it if it's not available to them. We want to get all of those babies to a full 40 weeks or as close as we can to that. We want to make sure that all moms and all parents actually understand the importance of safe sleep. They sleep on the baby's his or her back, in his or her crib with no blankets, stuffed animals around them. We know that that's easier said than done for many of us who get all those great fluffy gifts, but it's really important, particularly for our new infants, that they adhere to those safe sleeping standards. We ask moms to breastfeed if possible. As far as our state initiatives, there is a Mom's Helpline, which is maternal and child health, part of the Maternal and Child Health Division. It is 1-844-MCH-MOMS. Again, 1-844-MCH-MOMS. It's there really to act as that support helpline for moms when they have questions. Being a new mother can be nerve-wracking, and there are a lot of questions, there are a lot of uncertainties, but our state is working to make sure that the support is available at any time of the day or night. There's also a program called Baby and Me Tobacco Free. Again, we're talking about the importance of smoking cessation and or prevention during and after pregnancy. Baby health is critical to their long-term future success, and we want to make sure we can do all that we can to make sure that mom and baby grow up healthy.